Good morning. I am Joshua Freitas, and I am here to speak to you about prevention of inpatient hand sanitizer consumption for my evidence-based practice class with Dr. Carol J. Neal as the instructor. A little bit about myself. I'm a nurse. I've been a nurse for about 2 years, and I've been working on a progressive care unit where I have in fact seen a patient who was drinking the hand sanitizer to achieve a buzz or intoxication due to him not able to get anything else anywhere and being hospitalized for a different issue. So our focus is to search for the best evidence related to finding an alternative method of hand hygiene when caring for patients whom are admitted to the hospital with addiction to alcohol. Now, I know a lot of the nurses I have spoken to have had similar issues, whether it's the little alcohol swabs or the hand sanitizer. And like I said, I have had that issue as well. So our problem is ingestion of hand sanitizer in the hospital setting by alcoholics that are admitted and in the process of detoxing. Now, I told you I did have a patient like this, and I'll tell you my story here. So I told you I work on a progressive care unit, so the patient was actually in for another clinical problem, but he was a detoxing alcoholic, and I needed to be monitored before he actually went to his detox program that he was going to go to after this. So the patient was actually drinking the hand sanitizer, and we had the hand sanitizer that was on the wall that's in a foam form that you just spray into your hand and rub your hands. He was actually putting it into a one of those styrofoam cups and drinking it like that. So we caught wind of him, started monitoring, and noticed he would leave the room, walk around the unit, go back into the room, and we started noticing missing bottles of hand sanitizer on the walls outside of patients' rooms. I actually went in and found the bottle wrapped up in some towels hidden inside of the bathroom. He was just trying to get away with it, but I found it. And, you just noticed as his blood pressure was getting very low, he was getting more somnolent, and luckily he didn't progress any farther because I was able to catch him and warn the rest of the staff of the problem here. So it is real, and it can be very bad for the patient. Symptoms of sanitizer consumption, like I said, delirium, hypotension, depression of the CNS, central nervous system, depression of myocardial function, which is going to be your heart function. This, in the end, can be fatal. And in my case, luckily it wasn't, but I know in a lot of cases it can be. And you can be sent, to the ICU because of this, the one-to-one monitoring. But in one of the studies I was using for this paper and presentation, it showed that even one-to-one monitoring didn't stop the patient from consuming alcohol sanitizer. So very critical. All these problems listed are going to possibly be fatal, and it's very important to monitor this patient and ensure that they don't drink it, and that they know that this is not just any alcohol. This is not the same alcohol that you have when you're drinking tequila. I mean, it's got different ingredients in it and different percentages of alcohol. So the real question here we're looking at is it better to use alcohol-based sanitizer, or is it better to wash your hands? I think it is known that it's better to use hand sanitizer. That's why I'm doing this presentation as opposed to washing your hands. But there are other instances where it's better to wash your hands, like C. diff. You have to wash your hands if there's an outbreak of C. diff. The patient has C. diff or has been confirmed to have C. diff in the past. You always want to wash your hands instead of use the hand sanitizer because it doesn't do anything for the spores. So here's an instance where it's better to actually use the hand washing method with soap and water rather than hand sanitizers. So, but I did look into it more. We researched to find if that's true, that it's better to use hand sanitizer, and this is what we found. So with alcohol-based hand sanitizers, they're running like 60 to 95% ethanol or isopropyl. Now, I mean, that's actually greater than most of the spirited drinks out there, like vodka, tequila. I mean, I believe they're maybe 40% ethanol, and that's a good jump. So you can think if a patient drinks a whole bottle of this hand sanitizer, they're going to be either very, very drunk or, possibly overdose on it, which is what some have seen. So in the clinical study here, I found the most effective way to destroy MRSA in the clinical setting is to use alcohol-based hand sanitizers. It is the best way that they have so far, even over CHG wipes or washing hands. And it's much easier to use. You just spray it on your hands, wipe your hands, and the MRSA dries up with the alcohol. Very easy to do. Can't really get past how easy it is. Next, we have hand washing with soap and water, which is actually found to be less effective at destroying MRSA than alcohol-based sanitizers, but it is still a valid means to prevent transmission of MRSA. And definitely, in the end, should be used, if possible, with a patient using alcohol withdrawal, because personally I don't want to have them drinking alcohol and passing out or, becoming critical while I'm there as the nurse, and I don't want them, possibly dying from this because they don't understand. So when we find out that the patient is actually drinking the hand sanitizer, some interventions we can do is to carefully monitor the patient. Now, this patient can be pretty sneaky in finding ways to get this hand sanitizer. Obviously, they're sitting around the hospital for maybe several days, and they're, used to drinking maybe a liter of vodka a day or something. Who knows? So they're going to be looking for ways to get that hand sanitizer, and they're going to wait for you to let your guard down to go look around the unit like mine did. So, it's imperative that you inform the other staff, hey, look, I've got this patient who's using the hand sanitizer as an alcohol drink, and we need to look out for this guy. So it's good to monitor. It's good to put the patient out in front of the nursing station so that you can watch them. Basically, you just want to make sure the patient's safe. So you want to also let the patient know that, hey, I'm aware that you're drinking this hand sanitizer and I'm watching you. So, the whole floor is watching you. We have everybody watching you, and we'll call in security if we need to, and we know that you're doing this. So it's good to let them know. Of course, they say there's strength in numbers, and just letting them know is going to maybe deter them a little bit, because they're going to be more, less tempted to go grab it if they know everybody's watching. And of course, we're going to remove the alcohol-based hand sanitizer from the room and monitor on surrounding rooms. Really, that's the best intervention, is to remove the hand sanitizer, of course. Really, you don't have to remove the hand sanitizer, but really this comes down to a nursing judgment. It would be great if the doctor ordered, hey, look, no alcohol products around this guy, but that's going to be a hard thing to do. We have alcohol sanitizer all over the place, all over the hospital, outside each room, inside each room. I mean, you've just got a bounty of alcohol products out there in the hospital that if somebody really wants to get it, they're going to get it, unless you're really paying attention to them. So really, like I said, the doctor's not going to probably order something to say to remove it, but it's definitely a nursing judgment. You have the nursing judgment to remove it. And just wash hands and tell them to wash their hands. Have everybody just put up a sign like it's a C. differum, hand washing only, because we're not going to have the alcohol sanitizer around the area, because we don't want the patient to go critical, and really that's the important thing here. And here's all of our references, and thank you for watching, and hopefully your patient isn't trying to drink hand sanitizer while you're on shift or after.